I'm Sean Gables.
And I'm Blair Miller. It's good to have you here with us tonight. The DEA is now telling local pharmacies they can't sell THC despite a state law that says the opposite.
2 months ago, Georgia became the first state to allow pharmacies to sell cannabis oil. Now the DEA is saying this is illegal. Atlanta News First reporter Adam Murphy live tonight inside the Little 5 Points Pharmacy in Atlanta.
And Adam, the feds are targeting places that sell low-grade THC products.
Blair, here's the deal. The DEA sent letters like this one right here to pharmacies across the state, telling them they must abide by all federal laws and regulations and not sell THC. For more than 40 years, pharmacist Ira Katz has been treating customers at Little 5 Points Pharmacy in Atlanta. He recently applied to be one of the stores licensed to sell medical cannabis oil to those with a prescription and registry card. But the DEA sent this letter to Katz and other pharmacists saying it's against federal law.
I'm very disappointed with it.
Georgia's pharmacy board and state legislature passed a law allowing independent pharmacies to sell low levels of THC.
We always felt, we as pharmacists, that this is a drug, should be kept in pharmacy, should be regulated by pharmacy. So we're very disappointed that the DEA is choosing to keep it out of pharmacy where it really belongs.
Up until now, patients have only been able to get the low THC oil from dispensaries around the state.
They're not licensed with the DEA, the dispensaries. We are.
Katz said it's a setback for families in need of cannabis oil for urgent medical reasons. Todd Heidel agrees. He works for a nonprofit called Peachtree Normal, which supports the use of THC for medical purposes.
It's ridiculous. It's very frustrating. We have children that are sick, that need medicine, and need safe legal access. And in Georgia, it seems like every time we try to take a step forward, there's pushback.
Patients are going to come into a pharmacy because they trust us, okay? They understand we are the drug experts. What better?
Now, to put things into perspective, what we have been told is that heroin is also a Schedule I drug. I've also been informed that the Department of Health and Human Services has made a recommendation to lower THC from a Schedule I to a Schedule III, but at this time, no action has been taken. We're live at the Little 5 Points Pharmacy in Atlanta. Adam Murphy, Atlanta News First.